More than 1 million cases of skin cancer will be diagnosed this year alone. That is 1 in 5 Americans. In tonight's Good Health, Christy Kruger shows us what to look for and how to protect our skin.
Despite all the warnings about skin cancer, people still bake in the sun, soaking up those damaging rays. The first steps to avoiding skin cancer are staying out of the midday sun, using sunscreen, and wearing a hat. Dermatologist Resnik says adults, and especially children, need to get in the habit of putting sunscreen on every day, about 30 minutes before going out. Choosing a sunscreen with the right protection is a must.
The difference between none and a 15 is tremendous. It's about 93% protection. The difference between a 15 and a 30 is about 4%. I always tell my patients they should use a 30 because I know, number one, they're not going to use enough of it when they apply it. Number two, it's going to come off more quickly. And number three, they're not going to reapply.
There are 3 common types of skin cancer to be aware of. Basal cell carcinoma, which comes from the base layer of cells in the skin and looks like a pearly spot. Squamous cell carcinoma from the upper level of cells in the skin looks crumbly and pink or red. Then there's melanoma,
which comes from the color cells in our skin. That is by far the most deadly.
Basal cell carcinoma and squamous cell carcinoma have a 95% cure rate if detected and treated early. To determine if you have a problem area, you need to know the ABCDs of skin cancer.
The ABCDs of skin cancer are asymmetry, where the spot doesn't look the same on both sides if you try to fold it in your mind. B is border if it has multi-centered borders. C is color. A jet black lesion is not going to be a nice thing to have no matter whether it's good or bad. And diameter, the rule of thumb is larger than a pencil eraser.
Now, get a skin cancer screening, at least once a year to reduce your risk. To find out about free screenings, though, across South Florida this month, go to our web channel, local10.com.
A nip here, a tuck, especially with magazines and television promoting youth and sensuality.
I've had the laser, I've had the Botox, I've had the my eyes, the liners. I'd say probably 7 or 8 procedures.
Brenda Stone's not alone. Nearly 7 million Americans had some sort of cosmetic surgery last year alone.
I do it because I want to. It makes me feel better. And I like it.
If someone would have something that really bothers them, that they want to change.
According to the American Academy of Cosmetic Surgery, the most popular surgeries for women are breast augmentation, liposuction, and nose reshaping. The most popular non-surgical procedures, Botox, chemical peels, and microdermabrasion.
And women aren't only walking into doctors' offices hoping to turn back the hands of time. Thousands stepping up to the counter each year, spending billions of dollars on wrinkle-fighting creams and treatments. Some new products promising the gain without the pain.
Now we have a topical Botox.
That's right, no needles, treatment in a tube.
It relaxes your skin, and it literally takes away those lines.
And then there's the transformation on the inside.
Once you see a product starting to work, your whole demeanor changes and you feel good on the inside too. And it's really exciting when people come back in and they go, oh, I need more, I want more.
But in that search for beauty, doctors say make sure you're doing it for yourself. Also, do some research first. You can do that by going to a beauty night like this one in Aventura, where doctors explain and even demonstrate procedures on other patients. Also, ask friends to recommend a doctor and make sure they're board certified. In March 2001, a woman died when she was injected with silicone by someone who wasn't even licensed. And finally, know when enough's enough.
There are cosmetic junkies out there, and there are people that I'm sure every dermatologic and cosmetic surgeon has turned away because they simply can't meet their expectations.
I do it because I feel that just because I'm older, I don't have to look that way. I do it because I want to.
Nancy Phelps is a dance instructor from Virginia Beach, Virginia. She spends a lot of time in swimsuits and leotards. Her stretch marks from her pregnancy were a big concern.
The stretch marks were unsightly and made me self-conscious.
Nancy tried creams, but they didn't work. She said she was excited to take part in a study at the Laser Center of Virginia testing a pulse dye laser on stretch marks.
Hi, Nancy. How are you today? You all set?
The pulse dye laser produces a powerful yellow beam that feels like a snapping rubber band. It causes the skin to bruise for a couple of weeks. The laser works quickly and dramatically on new pink stretch marks, but if the scar is old and deep, it may take more treatments to work.
Originally, these studies were tried years ago, but the laser settings were too high, and the patients weren't followed for a long enough period of time. Some people don't even begin to improve for a couple of months.
Nancy's stretch marks showed dramatic improvement after one session. This is an area of stretch marks untreated, and this is one after a single laser treatment.
Well, I won't feel nearly as self-conscious in a bathing suit as I did.
Since the healing process can take as long as 6 months, Nancy should start seeing the results of this last procedure right around swimsuit season.
Lindsay Philby was 8 months pregnant when she noticed her first stretch marks.
After a few days, I felt them elongating, and of course I knew what they were. So it was a little depressing. It's just easier on the eye if you don't have them. I'm young. I'd rather not have them.
Everybody's goggles are on.
So Lindsay is trying to get rid of them surgically, but there's no cutting or anesthesia involved. Just goggles and a laser machine.
Pain is not a problem at all.
Big Narakar is one of the few doctors in Sacramento that uses this new medical tool.
Am I hurting you at all?
No, it's very tolerable. Are you kidding? Compared to having a baby, nothing hurts.
The laser beam targets the hemoglobin, a part of the blood vessel.
The first thing, it looks worse. It looks purple and red immediately after the procedure, and then there's some contraction. And over a period of about 3 to 4 weeks, the redness, it starts to disappear, and there's some shrinkage of the stretch marks.
6 weeks since laser surgery, and Lindsay Philby is seeing results.
After about 3.5 weeks, I noticed what had not been done was much redder than the area that you had treated with the laser.
This was untreated, treated, and untreated.
The surgery didn't erase Lindsay's marks, but both Dr. Narakar and Lindsay agree the color has lightened.
Within 4 weeks, there was definitely a difference between the untreated stretch marks and the treated ones. They were definitely lighter.
In the past few centuries, medical science has progressed rapidly. Today, advancements are even more rapid than 20 years ago, and their impact is just beginning to be understood. I'm Charlton Heston. This is American Medical Review.
Your face. It shows genetic family traits and characteristics, and it helps reveal your age. But because the delicate skin on your face is constantly exposed to the environment, it's more susceptible to factors that cause skin damage and the appearance of aging. The most significant of those factors is called photodamage.
Well, photodamage is a term that we created to describe all the effects of chronic sun exposure from early life into old age. And everyone is familiar with what that appearance is. It used to be called premature aging. We now call it photoaging because it has not got very much to do with getting older. It has to do with how much sun exposure you had as a child. The eventual presentation, of course, is quite clear. You get mottling, you get yellowness, laxity, sags and bags, and dyspigmentations, and rough, scaly, miserable skin.
As millions of baby boomers age, dermatologists expect to treat more and more people with photodamaged skin. One of those treatments is the chemical peel.
The purpose of the peel is to renew the outer layer of skin, the epidermis. It does this by removing the stratum corneum, which is the dead surface layer in human skin. After you remove the stratum corneum, you get a burst of cell division in the deeper living layers of the epidermis that move up rapidly to replace the stratum corneum that was removed.
One recently developed procedure being used by dermatologists is a beta-hydroxy peel using salicylic acid.
The way the beta-hydroxy acid peel is formulated, it only removes the outer layer, the stratum corneum, and does not damage the deeper basal living layers of the skin.
It's visual because then everything turns white and then you know where you are. So there's very little chance of anything damaging that penetrates too deep. It's an epidermal kind of peel so that the patients will get some stinging and burning for just a few moments, and then it's easy to wash off and it's neutralized, and then they can go about their business.
Retinol is another weapon dermatologists are now using to fight photo damage. Like beta-hydroxy acids, retinol also helps the skin produce new, younger cells. Recently, a new retinol cream formula was created for dermatologists to treat patients with sun-damaged skin.
It simply is converted by the skin. Retinol is converted into retinoic acid and has all the beneficial effects of retin A, except that it's less irritating and it's slowly delivered because it's in a microsponge system. It effaces wrinkles. It makes the skin less rough. It makes the skin firm. It's depigmenting, and in fact, what it really does is to return the photo-damaged skin to a more youthful condition.
Beauty isn't just skin deep, but new developments helping to care for the deeper layers of your skin. Bring a healthy, renewed look back to the surface.
Advancements like these give us hope for a healthier tomorrow. I'll see you next time on